Understanding yeast infections, symptoms, causes, and management. Yeast infections, medically known as candidiasis, are caused by an overgrowth of the fungus Candida. While Candida normally lives on the skin and inside the body, like in the mouth, throat, gut, and vagina, without causing problems, an imbalance can lead to an overgrowth resulting in an infection. Causes. The causes of yeast infections are diverse and often involve factors that disrupt the natural balance of yeast in the body. The fungus responsible, typically Candida albicans, thrives in warm, moist environments. Factors contributing to this imbalance include prolonged antibiotic use, which can kill off beneficial bacteria that normally keep yeast growth in check. Hormonal changes from pregnancy, menstruation, or hormonal contraceptives, and health conditions like diabetes that affect sugar levels, promoting yeast growth. Stress and a lack of sleep can also weaken the immune system, making it harder to regulate yeast populations. Additionally, a diet high in sugar may contribute to yeast overgrowth, as yeast feeds on sugars. Even habits like wearing non-breathable, tight clothing or douching can increase the risk by creating an environment conducive to yeast proliferation. Understanding these causes is crucial for both preventing and treating yeast infections. Symptoms. Symptoms of a yeast infection can present differently depending on the area of the body affected, but they generally share common discomforts that signal an overgrowth of Candida. In vaginal yeast infections, symptoms include severe itching, redness, and swelling of the vagina and vulva, a burning sensation during urination or intercourse, and vaginal pain. The discharge in such cases is usually white, thick, and odorless, with a consistency similar to cottage cheese. Oral thrush, another form of yeast infection, may present with creamy white lesions on the tongue, inner cheeks, roof of the mouth, or throat, accompanied by pain, redness, and even bleeding when the lesions are scraped. In severe cases, it can spread to the esophagus, causing pain when swallowing and a feeling of food being stuck in the throat. When Candida infects the skin, it can create a rash with red, itchy, and scaly patches that may ooze or produce a clear fluid. For systemic infections, which can be life-threatening, symptoms can include fever and chills that do not improve after antibiotic treatment, as the immune system tries to fight off the infection. Management. Management of yeast infections typically involves antifungal medications, which come in creams, ointments, tablets, or suppositories. Simple infections might require a short course of treatment, while more complicated cases may need long-term therapy. Maintaining good hygiene, changing out of wet clothes promptly, and choosing breathable cotton underwear can help prevent yeast overgrowth. Living with yeast infections requires attentiveness to body changes and prompt action to address symptoms. Adapting daily routines to include breathable clothing, maintaining good hygiene, and dietary considerations like reducing sugar intake can help manage and prevent infections. It's crucial to work with healthcare providers for personalized care, particularly for recurrent infections. Emotional well-being and support from others who understand the condition can also play a role in effective management. Through proactive care and lifestyle adjustments, individuals can mitigate the impact of yeast infections on their lives. Thanks for watching. If you found value in this video, please leave a quick like as it helps out the channel. Don't forget to subscribe to join our health-conscious community.